In this video, we are going to cover the Patient Care tab for the RN. The Patient Care tab is a different way for you to view all of your documentation on the patient or others' documentation without having to go through the work list. So if you remember, there's 3 different ways to view patient documentation. You could A, highlight the patient and click ED Summary, which will launch you to a preview. You would click the preview and you can see all of your documentation on that patient. And it would go in order. It would have allergies, medical history, then notes, then you would see lab data, all of your assessments. This is a very nice way for you to give a report. You also have the option of opening your patient's chart and using the clinical panel. The clinical panel will allow you to click ED Visit Summary, and it's very similar to that ED Summary here, but it pops up in a clinical panel view. So you can see everything in time slots, what you charted for your vitals, your intake, your labs, etc. The more documentation you had, it would populate. You also have the option to go into the work list, and on here you would be able to highlight any assessment you want to see, and you would be able to just hit view and edit. You can hit view and edit even if you didn't document it. You just would not be allowed to edit it. So I would be able to see here my documentation on the patient. The downside to this one is that if you're not editing anything, you're just viewing, you have to use the return to and exit the flow sheet. Any documentation is a flow sheet. The reason you would have to exit is because the save and exit is not available since we're not entering any documentation. An option that was developed for nurses is if you look on your show buttons on the left-hand column, or right-hand column, I'm sorry, when we are in the patient's chart, you can see under the show buttons you have a Patient Care tab. By clicking that tab, all of the assessments charted on the patient will be here, and you can even split it out by provider type, meaning you only wanted to see case managements, assessments, etc. And you would be able to highlight all your assessments or one by one and hit View Snapshot. This puts all of the documentation similarly into a clinical panel, but really only allows you to see your assessments on the patient. And it's a little bit more organized and you see everything in time frames. So for example, if I was looking at the patient's valuables and I charted something and then 20 minutes later my tech charted something or my sitter, it would all show up in little boxes in a row so you could track the documentation. There is no wrong or right way to view. It's going to be how you get used to it, and there are several options, and we just wanted to show you the different options you could choose to view your documentation and find information.